Hi, everyone. I'm going to get started talking today about our newly published book, the new edition here, The Psychological Assessment of Adult Post-Traumatic States. And just wanted to start off by kind of summarizing a few of the new features of the third edition. So it's quite a significant update. The last edition was published in 2004. So lots of new research to integrate, lots and lots of new tests, some older tests that have kind of gone by the wayside or gotten out of date with new versions of the DSM-5. So that's all integrated throughout. We have a chapter completely on teleassessment, specific recommendations for teleassessment, and then specifically discussing teleassessment with trauma survivors or when you're assessing trauma in post-traumatic states. And then overall, as the literature has been trending in this direction, the book takes a much greater focus on complex trauma, cumulative developmental trauma, not to the exclusion of others, but that section has certainly expanded. So this slide just gives you an overview, kind of a breakdown of each of the chapters, and I'll talk about some of the different sections in a bit more detail. The first two chapters, the first part is a kind of a comprehensive overview of the literature. So first on the different types, categories of trauma, the issue with respect to DSM-5 in terms of what qualifies for Criterion A trauma, when to consider other traumas in your assessment, and then a full overview, which I'll talk a bit more about in a minute, about trauma-related symptoms and disorders. And then part two here, you can see is sort of the meat, the practical kind of issues when you're diving into a trauma-relevant assessment. Lots of different things you want to consider, a review of all the kind of commonly used or well-validated, as well as some kind of up-and-coming measures in different areas, interview strategies, and that teleassessment chapter I mentioned. And then the last two sections, the two appendices, there's two measures included in the text as well. And one is more of a comprehensive trauma assessment review, which includes some kind of useful, important measures. These are both developed by my co-author, John Briere. The Broadband Trauma Adversity Review includes a number of events and items that don't appear on some of the more commonly used trauma sort of inventories. Some do, some don't kind of cover all of them, but this is where we get into, and I'll talk a bit more in a minute about some of the discrimination related or kind of social determinants of health issues that may also be traumatic. So homelessness or being unhoused is on there. Some potential traumas related to, say, assault by a law enforcement officer, immigration-related traumas. So those are sort of embedded along with some of the more typical adverse childhood experiences, physical, sexual assaults, motor vehicle accidents, combat, all of those things. The last measure, the Appendix B, is a brand new measure called the Social Discrimination and Maltreatment Scale, and it goes in detail about different social discrimination experiences and measures them for the respondent can report based on if they were discriminated based on their sex, their gender, or their sexual orientation or gender identity. So this just gives an overview of the different traumatic experiences that we go into that are covered by the different trauma exposure scales, but also that are in depth covered in terms of the literature and how it's related to outcomes. Lots of kind of the typical ones that you would expect. And then as there's more research developing in a few newer areas, we've reviewed what information there is out there on commercial sexual exploitation, moral injury, some of those newer areas. And then we have a section on COVID-19 related traumas and the new research that's looking at that, the social maltreatment, as I mentioned. And then here you can see we've covered a really broad range of trauma-related symptoms and disorders. Now, most people would probably look to this side here, maybe just the top half here, as those being the trauma-related disorders. And certainly PTSD, acute stress disorder, complex PTSD, and dissociative disorders are kind of the most aligned with trauma exposure, the most likely to be expected if you have a client coming in or you're looking to assess the clinical outcomes. But on the right side there, and this is included in the second chapter of the text, we cover each of these in terms of their relevance to trauma. They both, of course, should be assessed. Those on the list and potentially other disorders should be assessed from a differential perspective. But there's some literature in each of these areas linking these disorders with sort of the risk factor of trauma exposure or of potentially being a development as a result of experiencing trauma. Some of the special, kind of more specific issues that we attend to that are kind of trauma-specific assessment issues, as well as some are kind of assessment issues across the landscape. So as I mentioned, for teleassessment, the chapter covers the key guidelines, ethical principles, lots of the stuff that APA has put out, as well as other organizations, just all in one place, kind of a useful summary with the references to relevant documents there. And then it goes into depth when you're considering doing an assessment with someone who has a trauma history, how to conduct the assessment. So what might you be considering in a teleassessment context when you're building rapport, when you're establishing safety, when you're identifying confidentiality, some of the concerns that might be more of a concern when a client has a trauma history. In particular, the element of attunement, right? So if we're assessing over a video screen and that serves as a potential interference with demonstrating how attuned we are, or even picking up on the nonverbal cues or other sort of aspects of tone of voice that we might get a better sense of in the room, there's some guidelines and some information there around what to kind of consider as you're doing that. And then it also, that chapter also includes kind of what to include in your report, what factors to consider when you're administering a test virtually, when maybe not to administer tests virtually, lots of kind of considerations around these tests being normed, not in a teleassessment context. So that kind of goes into depth in terms of the teleassessment. We cover some of the issues with respect to underreporting and overreporting that are quite specific to a trauma-exposed client, as well as some of the issues that come up with normative groups. So again, these could be across different types of assessment, but may or may not come up a little bit more often with, or be a bit more relevant when there's a trauma history involved. So norms related to race and gender, some of those are kind of going by the wayside, but some considerations there. We give some specific recommendations for how to interpret scores when you're assessing with a transgender or non-binary client, and how to select tests as well. And then given that almost all of the assessment tools we use are normed on a US population, or at least a North American population, considerations that you might want to factor in if you're assessing someone from another geographic area, from another language or linguistic background, recent immigrants, those types of things. So that kind of covers the content of the book. I wanted to actually just to make it a little more practical. I'm a clinician. I like to kind of break things down in a more practical way, just to think through a specific case. If this case came into your clinical office, or you were considering developing an assessment or supervising an assessment with respect to this, how might our book be useful to you? So this is a young woman we'll call Sophia. It's a really dense slide, but I'll take you through it. So Sophia is a 24-year-old cisgender woman. She was born in Colombia. She lived there with her mother and her maternal grandmother from birth to the age of 5. She first spoke Spanish at home and now is quite fluent in English and has been since childhood. I'm from Toronto, so she immigrated to Toronto with her mother at age 5. Her father was living in Canada ahead of them and sponsored their immigration. And at this point in time, her childhood environment changed quite a bit. So in Colombia with her mother and her grandmother, it was a relatively calm, warm, loving, quite caring, trauma-free, we could probably say, environment. And when she and her mother moved, they moved into a home with her father, and that introduced a new environment that involved a lot of different traumatic exposures. So initially, she witnessed intimate partner violence between her parents, both physical and verbal. She also, as she got a few years older, her father had quite high standards for her schooling, for her behavior, wanted her to be and sound and look a certain way. And so different acts of psychological maltreatment and physical abuse were perpetrated often in response to or framed as punishment for some of these behaviors. So that might have been acts of humiliation, harsh criticism, as well as actual physical harms and physical abuse. And then, unfortunately, when she got to be about the age of 10, her father started sexually abusing her. And that continued on until she disclosed at around the age of 13. At that point, she was brought out of his custody. The parents were separated, and the abuse stopped. But of course, by then, that had all occurred. So considering this client, she presents to your clinic asking for a psychological assessment and interested in trauma-focused therapy. And just a very small print description of a number of the concerns she's coming in with. About 10, 11 years after she disclosed, she's reporting difficulty sleeping, frequent nightmares, difficulty concentrating, lots of worries about her safety, worries about her mother's safety as well. Episodes of quite intense emotion, lots of anger, lots of panic, having gaps in her memory. And she describes what sounds like derealization. And she'd also been having frequent somatic symptoms that she'd been undergoing some medical investigation for, and some persistent low mood. So I'm not going to open this up to answers just because of the sound and mic issues, but just for a moment, kind of consider this client coming into your office. What comes easily to you in terms of how you would proceed with that assessment? What might you have some questions about? What type of concerns might you have that you wanted to factor into the process of the assessment? Perhaps there are some tests or some specific metrics that you want to look at that you're not quite sure what's the most up to date or what's the most accurate with respect to some of these considerations. What types of differential diagnoses might you be looking at? So on this slide, I just sort of laid out, and I just have the chapters, not the actual chapter titles, because it would get too busy that way, but things I would think of, things I think many people would be looking at with this type of assessment. Initially, sort of setting out the assessment goals, cover some of that in chapter 3, and what you might be wanting to consider, what you can actually sort of have as a reasonable goal or achieve in a trauma-relevant assessment. Gathering a trauma-informed developmental history, as well as the specific tests and measures that you would use to assess exposure to potentially traumatic events. Those are all covered in chapter 4 quite comprehensively. Both screening tools. So for this client, we probably wouldn't be screening her. She's already coming in with quite significant symptoms, but in a primary care setting or a setting where you might just be screening for trauma symptoms, those are covered in chapter 4 as well. Some of the interviews and both strategies, tips, techniques that you might be considering with this client are covered in chapter 5, as well as the specific structured diagnostic interviews that you would use for this client and similar ones. Some information related to the validity of test responses, the over and under reporting I mentioned, as well as how the validity scales on some of the measures like the MMPI would operate, typically, and what the research shows, the ways that they operate within a trauma-exposed, especially a pretty complex trauma-exposed client. So that's in chapter 3 and chapter 6. Again, chapter 6 expands into each of those broadband generic tests. So the MMPI, the MCMI, PAI, a couple others. The Rorschach, and using the Rorschach with a trauma-exposed client is also discussed in that chapter. And then chapter 7 is what probably people think of when they think of a trauma-related assessment. So it covers pretty comprehensively the trauma-specific tests that are out there, the newest versions, as well as some of the kind of long-standing tests. There's psychometrics, as well as when it's most useful to use them. And then with this specific client, I would want to be looking at, and in fact, she did have some experiences of discrimination upon immigrating and in her time after that. And I'd want to be assessing around that. There's some guidance, as I mentioned, in Chapter 3, and then John's measures in Appendix B, and some cultural linguistic considerations that might come into play. So this is a client who immigrated almost 20 years before this assessment, but for somebody who is possibly a newer immigrant, or for Sophia, taking into account her cultural background, she's quite embedded within the Colombian community and the Spanish-speaking community within Toronto, that we want to be taking that into consideration as well. So again, there's some consideration of that in Chapter 3. So I'll maybe pause there. It's just a picture of the book and my and John's affiliations there. I'll take maybe the rest of the time just to do some questions, and if anybody has any comments or ideas to contribute.